We'll go to Mr. Fine from Florida.
Well, thank you, Mr. Chairman, and thanks for having this important hearing today. Before I get to my questions, I would note my perspective on this. I think it's incredibly important that we take care of those who get hurt on the job when they're working with the federal government. I don't think anybody disagrees with that. But fraud puts the legitimacy of any of those types of programs at risk. And more importantly, the way I look at the world is when you give $1 to someone who didn't deserve it, you steal it from someone who did. And eventually we're going to come up in a world where we run out of money, and so if we don't get rid of the fraud, we're going to end up cutting the things that we actually need to do. So Ms. Hull, in your written testimony, you talked about express support for using technology and data analytics when reviewing FICA expenditures. You talked about using AI and machine learning models to identify overbilling, which is a nice way of putting fraud, overbilling for physical therapy and chiropractic treatments. Using those technologies, what kinds of analytics, what have you learned from doing it? In effect, how much fraud have you uncovered by doing that?
We have worked closely with DOL, OIG in this space, but we have a pretty sophisticated data analytics program and have used it and pointed it at this data set to identify fraudulent activity. In some cases, we've identified upcoding or use of codes that result in higher reimbursement rates. We've identified employees that are getting significant travel reimbursements to drive hours and hours for treatment and things like that, which is in some cases can be fraudulent. We've identified providers that are prescribing these compounded pharmaceuticals, as we talked about earlier. We cannot. We see lots of potential fraudulent activity in this space. We've opened at the Postal Service OIG, we've opened about 1,000 cases in the last 5 years related to claimant fraud and another over 100 related to provider fraud, and worked many of those jointly with Luis's staff at DOL, OIG. There's a lot there. And the more we look using data analytics at this data set, the more concerns that we have in some of these areas from providers, but also from, in some cases, claimants. The issue that Luis raised about identifying people that have gone back to work and that are being compensated through other jobs while they're on the rolls, on the periodic rolls for the Postal Service. Many of our 1,000 cases that I was talking about are in that space where we've identified postal employees that are receiving benefits but are also working other jobs.
So if I were to put that in sort of analytic terms and numbers, sounds bad. Are we talking about like $100,000 worth of fraud, $1 million, $10 million, $100 million, $1 billion? We're talking about roughly $3 billion here. What's based on the analytics you've done, what's the scope of the problem? How many zeros come after the number?
Yeah, it's probably in the hundreds of millions of dollars in certain aspects. What we see, because the Postal Service employees often, and employees in this space can go on the periodic rolls. If they're committing fraud, they're not going to come off the rolls until they're investigated and are required to come off the rolls. And an employee that goes on the rolls when they're early in their career, 20, 30 years old in their career, that's a long-term liability. So that's $1 million or more over a career.
So that's hundreds of millions of dollars that's either being taken from a postal worker or somebody else who actually has a problem that they need help with, or that's money that we're borrowing from our grandkids to give to people who don't need it. Is that a reasonable way to look at it?
It is.
Thank you, Mr. Chairman.
Thank you. Next, we'll go to Mr. Messmer from